in medical school, I wanted to be an orthopedic surgeon, and especially a hand surgery. Then went to my internship in general surgery in San Diego, California at the Naval Hospital. And my second to last rotation in my internship here was in ophthalmology. So I became interested just by one of the attendings there. He was a flight surgeon as well prior to becoming an ophthalmologist in the Navy. Different patients that we had and a variety of problems that I encountered that I hadn't really encountered in medical school was extremely interesting, so I changed my focus. I then went to become a flight surgeon. I went to training in Pensacola, Florida, and then after 6 months of doing that and flying and knowing just aerospace medicine type of medical issues that we dealt with, I was a flight surgeon at the Naval Air Station in Jacksonville, Florida. And then I was my time that I owed the Navy back, so I ended up going to Syracuse, New York in a civilian residency in ophthalmology. So that was kind of my journey, and it was a little bit circuitous. I actually was encouraged as well by a group of reservist naval flight surgeons that were all ophthalmologists in Jacksonville, Florida. So they allowed me to come and shadow them at times, and when I was in the Navy and I had some time off, and that was very interesting, and really got interested in cataract surgery, eyelid surgery. My role at RAMC is as an ophthalmologist. That encompasses medical and surgical care for visual problems. What I deal with every day is cataracts and performing cataract surgery, but also glaucoma care, macular degeneration care, providing exams for diabetic retinopathy and evaluating for that. Our goal is always to provide care that is compassionate and individualized so that patients can have the best visual outcome that they are able to have. The most rewarding aspect of my role as an ophthalmologist is, for me, cataract surgery. It's very technologic, but also I'm able to see the joy in people's faces on the next day after surgery on their post-op visit, and how much improvement their vision has developed since the surgery. It's always never lost on me how important that is to patients and their ability to be able to read or drive at night or do the things that they had been normally doing, but now many people also become independent of their spectacle correction. It's always a joy to see that, but also in preventing problems that I know will occur if not treated early, such as glaucoma, and now more so with macular degeneration. I chose RAMC because of the sense of community and the cordiality, and everyone has been extremely nice. My wife and I actually visited prior to interviewing just to get a sense of the community, and we had such a wonderful time. We were looking forward to coming back and experiencing everything else that Reedsburg had to offer, and everyone delivered, especially from the administrative staff has been extremely kind and so responsive to all of our questions, and so we are very happy to be in the community and look forward to be contributors to the community as well. We both attend church and have many interests with regard to that, and my son has disabilities, and my wife is very much an advocate for developing programs and different lines of activity for him and anyone else in the community that wishes to do that, and we've done that in previous locations, and very much looking forward to helping any individuals with disabilities as well. In our spare time, myself and my family enjoy the outdoors quite a bit, so we love to hike and bike and fish, golf, variety of different things, and just like to be active and remain active as we get older, and it's always the most beneficial thing that you can do for yourself. I look forward to continuing that, especially in a beautiful state like Wisconsin.